The provincial COVID stats seem to be showing an improving picture. As of last Wednesday, there were just 8 people in hospital, and there were no recorded deaths in the previous week because of the disease. But a researcher at the University of Toronto is warning that the COVID risk in this province is still high. Tara Moriarty is a professor and studies infectious diseases. Thanks for joining us.
Oh, you're most welcome. Thank you for having me.
So you've put together the COVID Hazard Index, and you found that Newfoundland and Labrador is right now sitting at high, in fact, higher than any other province. Why do you say that?
So Newfoundland and Labrador was had really come down, was really improving for several weeks until the most recent Hazard Index update, which is for up to Saturday, July 9th. What's happening now in Newfoundland and Labrador is that the test positivity rates are increasing really quickly. And that may be related to a BA5 surge in the province, like in many other Canadian regions. And so what this means is that it's likely that hospitalizations, ICU admissions, deaths are going to begin going back up again. And wastewater is also increasing in Newfoundland and Labrador as well. So this suggests that we're starting to see a lot more infections again, and that people should really take care, especially because a lot of the people who haven't been infected yet during Omicron are people older than 40, whose vaccine protection is probably waning. So we may actually see more severe outcomes in the next big surge than previously because the people who will be infected are more vulnerable.
So how do you reconcile those numbers with the stats that the province has put out that shows that, you know, the numbers have actually been quite low? People aren't dying, people aren't ending up in a hospital.
So things have been improving. It was really starting to look good for Newfoundland and Labrador. But it is worsening again now, and people should be aware of that and recognize or be aware that there is a new surge or wave that has started in other provinces with the BA5 variant, and it's clear that it started now in Newfoundland and Labrador as well.
You mentioned masks. People should be thinking about wearing them. I know anecdotally, when I was at the grocery store on the weekend, you know, we've gone from most people wearing them to now it seems like most people aren't wearing them. How much of a concern is that for you, and how much do you think that has the potential to increase the surge that we're seeing?
Yeah, so mask wearing actually is very important. It doesn't prevent all infections, but it certainly slows the spread down. It blocks chains of transmission so that fewer people are infected and that fewer, you can, probably prevent 25% of infections over time, which is a lot actually. In an Omicron surge, it's a lot of infections you can prevent. But the other really important thing for people to realize is that slowing down chains of infection is really, slowing down transmission is really important so that healthcare systems don't get overwhelmed, so that hospitals are available for people who have not just problems with COVID, but with other things that need urgent care.
You mentioned hospitalizations. So far, the Newfoundland and Labrador health system has been able to keep up with the number of people showing up in hospital because of COVID-19, but you've been figuring out what the cost on the healthcare system was because of the Omicron surge. What did you find in terms of what it's cost to be able to treat people who have COVID?
So we estimate that so far with Omicron, apologies, I just have to look up my number here, that the cost of hospitalization in Newfoundland and Labrador has probably been about $62 million. That would be since the beginning of December. And the daily cost expected based on the hospitalizations we expect from the infections that are happening now is nearly $400,000 a day.
Well, I appreciate you joining us and sharing some of your analysis today. Thank you very much.
You're most welcome. I'm always glad to help.